And then preparing for medical emergencies. We teach that in all our programs. And I really love emergency preparedness. That is like my jam. I geek out on it. Like I have water and backpacks and, apocalypse cookies packed away, and I really am about emergency.
Cookie is an apocalypse cookie.
A nutter better. Yeah. And those last a long time. Just like Spam, right? Doesn't that last a long time? But like emergency preparedness, and like it hasn't failed me because you remember when COVID hit and they were like the KN95s? I was like, I think I have about 150 of those. And Sarah called me and was like, you need to give those away. I was like, no, I'm going to use them for Nurture Nature because
And
they
we needed them.
And they were Nurture Nature's emergency preparedness for like fires. And so we had KN95s ready to go because of my obsession with emergency preparedness. But these are skills we actively teach little kids is like what to do, if there's a fire, if mommy falls down, if, the what if situations. And we teach this both in role play and through, I'm Spider-Man and, call the ambulance, so we'll teach it through actual play, interactive play. And we'll also teach it with visuals. But there should also be constant teaching of emergency preparedness.
Yeah, it's important that we have things planned ahead.
Yeah.
And I think the skill set you're talking about building is really a lifelong skill set that client should have. Is this an emergency? Is this not an emergency? What should I do in case of this happening? Because the worst situation, is where someone does get injured and then there is no help provided.
Yeah. My husband actually had to put his foot down because we're in Los Angeles and there was the horrific Palisades fire and the Pasadena fires that we lived through. And that was really horrific. And we tried to help as many people as possible. But I was like, Kevin, we need to get the thing that makes the pool water pump into a hose to spray the house. Or we should get the fire tarps, because I learned about the fire tarps up in the National Forest where you have to cover your wood in these fire tarps. I'm like, the fire doesn't penetrate these tarps? I'm like, no. I was like, we should get tarps for the entire house. Kevin was like, no, we are not doing that. And you can't get that $1,000 pool pumping water hose system. It's like,
fine.
But I was like, but what ifs? Sometimes I like to prepare for the what ifs. But not to get children to be paranoid, but if there's a fire, who do you call? If someone, those community safety helpers, what to do if you lose track of mommy and Target? Like you should actively teach these skill sets to children. And it should be a part of their ABA program.
I agree.
Yeah. But when you're dealing with a patient that is medically fragile, emergency preparedness takes on a whole new level of being prepared.
Absolutely.
So what does that look like?
Yeah. So we talked about the medication list and having that ready to go. I think that's always really important. And having a little book would be really great with your medications, your diagnoses, your providers, your insurance information, all of the things that you might need should you have to suddenly make a fast trip to the hospital. Recognizing those signs and symptoms. So you mentioned the little boy turning blue. There's also little devices you can put on your finger that tell you your oxygen saturation in your body. That can be really helpful. It takes 2 seconds. If that's a concern, I think that's a really helpful thing to keep around. And then, what are we seeing? Is he having a seizure? What should we do when he's having a seizure? In the past, they used to say, put something in their mouth. And we know you don't do that anymore because you're more likely to choke them or to have some harm occur by putting something in a person's mouth when they're having a seizure. So typically the advice is roll them on their side and protect their head until it's over and then, get them to emergency services.
But in a bag ready to go. What should be in the bag?
I think what should be in the bag is some change of clothes, should be any medications, maybe some, backup medications to have available. Also, those toys we talked about, right? Having some activities, some things that will make them feel more comfortable should they be admitted into the hospital or should you have to wait in an emergency room for a certain period of time. And then, of course, that book with the medications is really important to have as well. I think also a phone charger is a smart thing to have should you need to contact family or should, for whatever reason you're in the ER waiting, you need to contact someone. Um, yeah, so I think, and it would also depend on that specific child. If, we do have oxygen that we need to make sure we have with us. We do have, the feeding materials. Should they have a feeding tube? You need all of that medical equipment ready to go. Should you have to leave at a moment's notice.
And then apocalypse cookies.
And apocalypse
We
cookies.
should really consider the
This episode brought to you by Nutty Butter Apocalypse Cookies.